happy to be here another year. My name's Jimena. I'm with the Philadelphia Inquirer. To make the most of our time, I'm going to hand it over to our panel, who will give us some ideas to take home. If I could have each of you introduce yourselves with your names, your titles, and what it is that you do, and we can start from this end and just move down the row.
Okay. Good morning, everyone. My name is Larry Bader. I work for a company called AmeriHealth Caritas, which is a managed Medicaid company based out of the Philadelphia metro area. I'm the Vice President of Talent Management, Leadership Development, and Enterprise Learning. And we're about a company of about 10,000 employees.
And I'm John. I am a physical therapist and clinical specialist at Sword Health, which is a musculoskeletal virtual care platform.
Hi, good morning. Kendra Griffith. I'm a health and welfare consultant at Marsh McLennan Agency, and we're a global risk management firm.
Good morning. My name is Melissa Winkelman. I'm the Senior Vice President of HR for NFI Industries. We are a third-party logistics organization with 18,000 employees, and we're headquartered right across the bridge in Camden, New Jersey.
Hi, everyone. My name is Catherine DeGrossa. I'm the Corporate VP of HR for New York Life, and I've spent the last 2 decades leading HR teams across 3 sectors: insurance, financial services, and healthcare. And currently at New York Life, focused on leading and supporting programs across talent development, culture, and workforce evolution, all anchored in our values of humanity, integrity, and long-term impact.
Impressive group. Okay, so before we get started, I want to get into how to tailor benefits to improve employee well-being, and I'd like to take a minute to acknowledge the economic landscape companies are facing. The economy is said to be slowing, with the most recent economic data showing that the labor market is in a downshift and inflation is accelerating again. So how are companies reconciling the current business landscape with this idea of investing in employee well-being, and why should companies invest in these well-being programs despite these outside influences and constraints? And for this, if Kendra could kick us off.
Sure. So I want to acknowledge that this is quite an uncertain time. Most recently, McKinsey released a study about economic uncertainty, and levels in 2025 are reaching higher than post-2008, post-9/11, and we're nearing uncertainty levels of COVID. So that's where companies are at, and I think to kind of break through that, the important piece, the reason why, is going to be to establish stability, long-term stability. So when you set up a strategy for well-being that can be executed and properly forecasted for 3, 5, or 7 years, and then you can report that up to your C-suite, you can protect your programs, you can protect your budget, you can protect, most importantly, your people from things like budget cuts, reorgs, benefit cuts, layoffs. So it's important to establish that stability and that longevity through predictable strategy.
John?
Yeah, so a reoccurring theme we hear in the market is cost containment. You know, everyone's being asked to reduce costs while also dealing with the increased cost of healthcare. And so, you know, MSK, musculoskeletal, is a top cost for a lot of employers. We spend in the US annually over $400 billion on MSK conditions. And so, you know, finding a, solution that addresses both the costs that you are, tasked with dealing with, but also justifying a ROI for a benefits program is vital as as a company. And so choosing a strategic partner that addresses those costs, but also increases employees' well-being is critical year after year. And so from a Sword perspective, we are able to show that we are able to decrease surgery intent by like 70%, decrease depression by like 64%. So we're having an impact on employees' well-being and their overall health. But then we're also able to show that cost reduction. We have a 3.2 to 1 ROI, and we are confident in our abilities to do so. So we're able to then guarantee that you would see those benefits within the first 12 years. So it's important that you partner with strategic partners that are able to show you that and justify that and bring that to the table as you move forward.
And Larry, how do we reconcile all these economic factors, and why should companies even bother, looking into employee well-being?
I'm going to zoom out and up a little bit for this answer, and I think it's kind of simple. It's an acknowledgement and a choice. And I think the last presenter hit the nail on the head when he was talking about financial well-being and the fact that when we come to work, we're not leaving parts of ourselves at home. And we have to acknowledge in the workplace that if people are going to flourish, we need to create infrastructures and mechanisms to help them do that. And it's really our responsibility if we want to help them be successful. And we want to be successful as organizations.
Yeah. What I like about this group is that while there's a lot of overlap in how your companies approach well-being, there's also a lot of innovative approaches when dealing with the emotional and physical needs of your workforce. To start, I'd like to hear about how your companies are addressing employees' emotional needs and general workplace satisfaction. The most successful companies are doing more than offering pizza parties these days. Can you talk about some of the more innovative or successful approaches you're seeing on this front? And Larry, not to pick on you twice, but if you could kick us off.
Yeah, so I think of, I'll go back to the word flourishing, because I think that's really important. When I think about well-being, I think about the idea of flourishing. So I think about it in a few different buckets or strata. I think about the things that are more commonly thought about when you think about well-being and flourishing. So our organization has done some really great work over the past year. We've partnered with Lyra Health to address mental health in the workplace, which has been phenomenal, and just recently launched a capability called Parallel, which is for caregiver support. If you're any age, you're probably taking care of yourself, kids and parents today. So being able to get support in that way is really important. And I also think about flourishing in the context of human connection. And I think about some things that we're doing in the organization, specifically around a mentoring program, which we have a very robust formal mentoring program, which is also supported by a technology platform, which helps us measure its effectiveness. But we have several hundreds of employees and associates that have been engaging in that on an annual basis. We also have associate resource groups, which have been proven to be very effective in the organization, and they're tailored toward different groups, so people have that affinity. And we have a couple that I really like to think about when I talk about our veterans-focused ARGs, as well as an emerging leader ARG, which has been very helpful. And then the last thing I'll say is I think about flourishing in the context of aligning your talent practices. So one of the things that we've been very intentional around over the past year is creating development programming that is, I know everyone talks about skills-based, but it is very skills-based, so we try to make it very sticky, a methodology where we teach the skills, they learn them, they apply them, and they talk about how they're using them differently to get different results. And then last but not least, when I think about setting people up for success to flourish through talent practices, I think about modernizing performance management, which is not, you should be doing that. We're getting there. We're actually eliminating ratings at different parts of the year through our practices to decrease the anxiety that we know is generated from preparing them, delivering them, and receiving them. And we're also trying to connect people better to the organization's priorities by formally launching a cascading goal process.
Okay, we're getting rid of the pizza party. We're addressing workers' emotional needs and general workplace satisfaction. We're talking about innovative or successful approaches. Melissa.
Yeah, so certainly in our organization, right, in a logistics business, we have a 24/7 operation. I have employees in over 40 states and 3 provinces in Canada. So I would say traditional wellness approaches are really hard to execute and scale with this kind of population. And so really we took a lean and kind of maybe did a little bit of a shift and really took time to really focus on career mobility and career development as part of that employee total well-being strategy for people. And so certainly you talked about other precedented times, 9/11, certainly post-COVID, we know that for employees that, they find energy, right? They find emotional energy in knowing their work matters. And so certainly we've partnered heavily with our marketing and communications team and really leaned into showcasing what our employees are doing in their workplaces, showcasing how our drivers are winning and how that really impacts the customer, showing what's going on in our warehouses and showing those opportunities and where they make a difference in the communities that they work in. This doesn't just help us from a talent acquisition perspective, but it also helps us from an internal retention perspective to let people know that there's other opportunities for them across the organization, not just in the lane of business that they work in, but that they can migrate and move across different parts of the business and have a more longevity, a longer career with our organization. I think you talked a little bit about data and information. We have so much data and information available to us, and if we're not looking at it to try and identify where we can get ahead of things, then we're losing from that perspective. We utilize an employee engagement tool where we're surveying people at various intervals across their new hire journey and while they're employed with our organization, and then especially on the way out. And that tool actually gets to flag sentiment for employees as well, where we can identify positive things and negative things, and we're actioning them. And it's not, when I say we're, it's not HR. HR is a partner to our business that has really adopted that tool as a way that they can get in front of things and really notice if there's upticks in absenteeism, if there's upticks in negative sentiment, and they can address that in real time to potentially get ahead of burnout and other challenges before they come into place.
Yeah, I also really love that. What a small detail to just promote the work of like your employees. It's like a small thing that you can do, but it has a big impact. Catherine, any innovative or successful approaches you've seen in sort of addressing emotional well-being?
Yeah, so at New York Life, we know that flexibility, autonomy, and meaningful connection really drive satisfaction and emotional well-being. And we have an intentional strategy around our work environment, and that is a hybrid work environment that allows employees to really integrate work and life, but also preserve our culture and the community of New York Life that's so unique. We also know that leadership is a key driver of well-being and satisfaction at work, and that's why we've invested in Lead Forward, an AI-powered management development program that builds empathy, helps leaders effectively coach as well as navigate tough conversations. So it enables managers to meet each employee where they are and personalize that experience, making it more human than just digital.
Yeah. Healthcare is our next topic. It is not getting any cheaper. So given the rising costs of healthcare, what are some cost-effective ways companies are tackling employees' physical well-being? And for this, I'd like to start off with John.
Yeah, so obviously, I'm going to come at this from Sword Health as a vendor, but also a physical therapist standpoint. Sword Health is a very cost-effective solution in this space because we are making access to care more convenient. We know that physical therapy works, but people have to be consistent with it in order to actually get the benefit from it. And traditional physical therapy is always met with a lot of barriers. You have co-pays, insurance limitations, people have to take PTO to go to appointments, all of those things, which then leads to people dropping out of physical therapy and pursuing less effective or more expensive solutions like surgery. So we created a virtual model that allows people to seek physical therapy from the comfort of their home or actually wherever they are without sacrificing that clinical grade, with still having physical therapists involved in the care from start to finish. And in doing so, we're actually seeing 2 times the engagement and retention when it comes to physical therapy than traditional physical therapy.
Yeah. Kendra, what are some cost-effective ways that companies are tackling employees' like physical well-being?
Right. So, and like you said, the cost of healthcare continues to rise, and I think we're seeing levels of dissatisfaction with the healthcare system from our employees that we've never seen before. So folks are feeling jaded, they're feeling the cost rising, they're feeling that hit their household, hit their wallets. They're getting less time with their physicians. They're really only getting attention when they're truly sick. And that's reflecting in their morale that they're bringing to work. So something that we're seeing and we're using is a direct primary care model. So this is kind of bringing back that established relationship with your primary care physician. And that's a model that lives outside your traditional health insurance program. So you get time with your physician, you get well visits, you get all of your lab work under one price. So it's something that we've really never seen in years, of that kind of shortening doctor's appointment and less time to focus on our physical health. You can also accomplish that through something like an on-site clinic. If you have a grouping of employees or a headquarters, that you could host something like that. And not only is that great for the physical health and morale of the employees, but it's great for the health of your plan. It's great for your claims. So we're seeing that pop up more and more, where they're truly incentivizing that engagement with healthcare. For years, we've been incentivizing things like biometrics or wellness visits, or even just establishing a PCP relationship. But now we're really investing in that long-term relationship to improve the health of our workforces.
I love that. I'm in the process of finding a new PCP, and it's a nightmare. No one's available until December.
Yeah, 6 months.
Okay, we've already talked about financial well-being in earlier sessions. This is a trend that I'm seeing companies focus on. My understanding is that this category includes everything from ensuring employees have individualized benefits that work for them to helping people with the burdens of childcare. Could you give us some examples of financial wellness programs? And for this, Catherine, if you could kick us off.
Sure. This is an area where personalization matters deeply. And we've taken and prioritized a multi-layered approach. One of the standouts for us is the student loan repayment program. So employees, excuse me, can earn $170 a month, up to $10,200 with no waiting period. And we couple that with financial counseling one-on-one to help them clarify their financial goals and develop confidence. So far, we've distributed more than $14 million through that program. So we're really proud of that. And then longer term, we focus on educational and financial programs such as tuition reimbursement, academic advising, and then through our group benefit solutions portfolio, we've extended critical care, accident and hospital indemnity insurance to enable choice for our employees to cover, to make a choice around covering those costs across their life stages. So those are two standouts for us.
The student debt is tailor-made for me.
Yeah.
Melissa, can you talk to us a little bit about financial wellness programs?
Yeah, for sure. I mean, I appreciate what you said, right? It's about meeting people with solutions, right? Meeting them where they are and providing them solutions, that matter, that they can really take advantage of. Like most of your employees, right? We have employees who are trying to help with care for children, care for elder people. They're trying to pay their rent, their bills, or they're just trying to buy groceries, right, every week. And so these financial solutions that you can provide to people are really important because it is part of your retention strategy. Employers used to think that all they needed to do was provide people a job and a paycheck, and your employees could take care of the rest. And I think we heard that speaker, certainly say this morning as well, is everybody brings their whole self to work, so whatever is happening at home is certainly translating in those pressures, into the workplace. A couple things that we've taken a look at prior as well. All of our employee base many years ago was paid biweekly, and we knew that that wasn't sustainable, right? So we did take a look into the early wage access or earned wage access programs and other things like that. And we said, well, maybe we should just take a step forward and try to pay everybody weekly, right? So why don't we pay our frontline and hourly population weekly, right? And give them access to their pay sooner, so then that reduces that stress, from them, from that financial pressures on their payday. We have partnered with other programs like SoFi, and we certainly have a lot of programs available through our employee assistance program, which our HR team spends a lot of time promoting the value of that because there is financial counseling available for them. There's also debt repayment and consolidation through our SoFi vendor as well. And all of those things are free and available to employees. And most times you are spending a lot of time and effort putting together programs that nobody knows anything about, and they don't know the details of the services that are available to them through those. And so having some time and taking that time to have that comprehensive benefits education all year long and dripping all of that information out to people is more timely and can really help them, because this financial wellness is really a huge part of retention strategies for sure in the organization.
Yeah, and I love the weekly pay idea, because it's, again, now that I think about it, it's like, oh yeah, my favorite jobs have always been the ones that give me a weekly paycheck. Kendra.
My favorite. My least favorite job was when I got paid once a month. I remember that. That was terrible.
Never forget.
Yeah, I also did the once a month thing, and I don't think I stayed there for a year. Kendra, financial wellness.
Yeah, so as Catherine and Melissa have discussed, the need of employees is evolving. So it's no longer that kind of traditional paycheck and a 401k. That's not the holistic financial need of the employee. For example, now we have, more than ever, we have 2 working parents, families that are working for our organizations, and how can we take care of the financial needs of those families that work for our organizations. And I think I'd be remiss if I didn't mention paid leave. Paid leave for maternity, paternity, caregiving situations, adoption. So employees are gonna feel supported to grow their families financially by their employer, and then they're going to be more motivated to return to work and feel engaged through their employer with programs such as that. That increased need for leave is really apparent in the market when we look at people's data. There's also childcare benefits, because quite frankly, the cost of childcare in this country is a crisis. And employees are facing that as they're trying to grow their families and simultaneously advance in their careers with your organization. So there's childcare benefits, there's childcare subsidies, there's on-site daycares available, there's emergency daycare available, there's lifestyle accounts that you can set up through your employer. So there's all these ways to impact the financial well-being of families that work for your organizations and contribute to your organizations.
Yeah. Now is probably the time to discuss the biggest game changer in how companies are dealing with employee wellness, and that is technology. How are companies incorporating tech, and more specifically AI, which is coming for all our jobs, just kidding, to fulfill employee needs? And John, if you could kick us off.
Yeah, so actually this is a very exciting topic for me as a physical therapist. I never thought I would be discussing technology in this way, and it makes me feel like I'm living in like the year 3000 with what SWORD is doing. We use it in multiple ways. We use it to enhance the member's experience and then also empower our physical therapists. So starting from the member's experience, and you can see this, we have it in our booth. We have Phoenix, which is our AI care clinician, who provides a pre and post session bi-directional communication with the members when they're at home. And then also our technology that we have provides real-time biofeedback to the members, so that way when they're doing these exercises on their own at home, they're getting the corrections in real time, they're getting the instructions, while the physical therapist is not there to evaluate the session. And then on the physical therapist side of things, because of that tech, we are then able to gather a whole bunch of data that our physical therapists then can use to help adjust, tailor, and modify a program for a member as they go through it. And then also on the back end, we've created what we call a PT portal, which is where a physical therapist spends most of their day and kind of goes through their workflow, and we've made it way more efficient for them to be able to do so. So it's been pretty exciting thing seeing as a physical therapist I never, again, thought I would have the opportunity to do.
Yeah. I love that. Larry, how are we using tech and AI to address employee well-being?
Yeah, again, I'm going to stretch this out a little bit to connect more with flourishing and how we show up in the workplace. And just a couple areas that come top of mind is we also use an engagement survey process that we're really leaning into hard over the past year. And there's obviously built-in AI technology that helps us gain better access into sentiment and themes that people are thinking about that we need to address as an organization. And then I think it's just in some of our other talent practices when I think of how we help people learn and grow. And many of our learning management system that we use is evolving using AI technology to help us better identify people's learning needs. So again, it's a different way of looking at well-being and flourishing in the workplace outside the traditional mechanisms, but that's what we're focusing on.
Yeah, I love that. And I love that AI is not seen as like a threat. It's more so an aid to the work that we're already doing. One thing that we mentioned at the top, and that was how companies are moving past one-size-fits-all programs. How are companies addressing the mixed needs of workers, some of whom may be in offices, others who may be in warehouses, and all those who are in different stages of life? And for this, Melissa, if you could kick us off.
Yeah. So I think for us, that's probably the biggest balancing act, right, we have in logistics is flexibility, right? Everybody wants flexibility, but if you're working in a warehouse or driving a truck, the amount of flexibility you have to do your job, you certainly can't do it remote, always presents a challenge. And even for us traditional office folks, we're back 5 days a week to the office as well. But even for a professional person, I still have more flexibility, right, in my day than somebody, certainly who is working, in a warehouse. And so for us, it was really important. We needed to think about a roadmap differently to where we can provide some flexibility to people because everybody wants it. Everybody wants that flexibility. So a couple of years back, we certainly partnered with our timekeeping vendor to be able to have people provide access to request their time off that they need right from their phone. So they can do that through a mobile app and be able to kind of get those requests in and helping them balance that as well. Along our roadmap, we also have the opportunity where we're going to be moving into more of a flexible scheduling. So you can pick up shifts, you can trade shifts with people as well. So giving people that opportunity because life happens and we need to be able to give flexibility for when that life happens outside of attendance programs or other flex programs, that we have available for people in the workplace. And, that technology, certainly helps people feel more valued in the workplace, that we do recognize and we are meeting them where they are with solutions that help them manage their day-to-day life, when it happens. I think the other piece from that equity perspective, as I said before, is we continue to leverage a multimodal channels to be able to get information to employees. So it isn't just HR, it isn't just communications, but we really leverage the work of our ERGs to bring, valuable benefits information to people. And they are probably the most heavily engaged groups. As a matter of fact, one of our ERGs, is the leader that hosts the benefits fair, right, for some of our larger campus locations. And so being able to have the message be told from other workers, and now are they 100%, benefits experts? Some of them are because they're HR team members who lead these ERGs, but some of them, certainly hearing the voice about how the offerings within the benefits programs really matter to the day-to-day employee and getting that information out there, again, using multiple channels, as many places that we can, to get people to recognize that really helps them drive the value of what they're paying for, and that it can help them, promote their overall, financial and just emotional well-being throughout the workplace.
Yeah. One size fits all doesn't work. John, how are we tailoring these wellness programs to employees who are in totally different stages of life?
Yeah, so again, coming at this as a physical therapist, I know that not two people are the same. They both could have back pain. We treat them completely different. And so that is why SWORD created a comprehensive care platform that will address the multiple needs that people have. Inside that, one of our programs is called MOVE, which focuses on pain prevention and injury avoidance. So 2 people would join that program, someone who is a desk worker, someone who is in a warehouse. They're gonna need 2 different programs to go through to reach their goals. So we've created programs that take into account the members' goals, their work demands, their hobbies, their condition, all of that stuff, so that way we can make sure that they're getting into the right program, but then also once they're in the right program, that they're getting set up with the right support and resources and exercises that they need to kind of reach those goals moving forward.
Kendra, how are we tailoring these programs?
Yeah, so in order to tailor the programs, I think it's important we take a step back and dive into our data. Your data is going to be your most powerful tool. So we talk about things like looking at your medical claims and your utilization, and not just looking at that from a holistic perspective, but even asking for it to be broken out in different demographic subsets. So if you want to ask for it by work location and see the differences in the utilization across your different locations, I think there's tangible data points that you can tailor your solutions to based on their work location. Or you can do it on things like age and see the generational differences in how they utilize their healthcare at your organization. If you have a large manufacturing site, offering something like an on-site clinic, again, that's going to be meeting the employee where they are and tailoring their healthcare to their specific needs if they spend the majority of their day on your manufacturing site. If you have remote employees that are kind of placed all over, might be more tech savvy, consider what enhanced telehealth options you're offering them and how you're meeting them, even if you don't get to physically see them every day. And then beyond that, beyond the medical claims, I encourage you to look into the data on your leave of absence programs. So why are folks taking leave? Why are folks using FMLA? And taking those data points and tailoring solutions that way. There's been a 300% increase in mental health leave since 2017. So if you're seeing a massive upswing in mental health leaves of absence, it might be a great idea to consider enhanced mental health opportunities, whether that be virtual or in person. So things like that I think are going to be really telling. You can also connect it to your workers' compensation data, if you take a look into there, and then maybe enhance your safety program. So something like that, that's going to make a difference on both your workers' compensation data and your leave of absence data. So there's ways to use your own data and optimize those opportunities from it.
Yeah. And I love that because it's already in-house.
It's yours, yeah.
Okay, we talked a lot about what companies can do to address employee needs and why, and we have some really good examples that you guys can take home. But before we go, can we discuss some of the pitfalls to avoid? We joked a little bit about the pizza party, but what have you seen that doesn't work? And if we could just go down the road for this one, starting with Larry.
I don't know that I would say if it doesn't work in my own experience. I think it speaks to what the other panelists have talked about, and what the theme of this panel is about is that one size doesn't fit all. So it's really taking a look at your demographics today. It's thinking about what it might look like in the future as you think about your employee value proposition and how you want to attract people to the workplace in the first place. So I think it's just this ongoing a kind of evolutionary approach about looking at what you offer and having a really diverse array of opportunities for people that are with you and not with you yet in your organization.
And I would just say, obviously there's a lot of problems to solve, and so it's often tempting to take the easy route and partner with other solutions that already have a contracting path with your health plan or with another partner of theirs or yours. And so we see a lot of times people coming to us years later because they weren't satisfied with their previous vendor. So I would say, put in the resources, put in the time to truly vet some of these companies that you're thinking of partnering with, so that way you can make a smart decision and not have to backpedal later on because things didn't work out and you were surprised by some increase in costs with some of the other partners.
Pitfall to avoid would be point solution fatigue. I think you can easily fall into the trap of having far too many point solutions. where that just creates unnecessary hurdles for employees to jump through, but it also is difficult to demonstrate ROI if you have too many smaller solutions spread out across multiple areas.
It's like I'm keeping my inside voice about that. So I think, for me, it's a couple things. It's one, assuming that good intent really is going to deliver good impact, right, from that perspective. And I'll go back to what Kendra said and the other panelists said. It's about not ignoring your data from that perspective. And so, like many of you, we've probably spent a lot of time rolling out programs that we thought were going to attack the solutions, but really very difficult to generate the actual desired outcomes. Either employees didn't know how to use them, they were very complicated, or the ROI, or they really didn't impact that, right? So if you don't have somebody, or if your broker or whoever your benefits broker that you're working with or internal isn't looking at your claims data, that's where you want to start, right, to be able to target that. And we have had some success, with some point solutions, but some very simple things that we had where diabetes is a top condition, right, for us from that perspective. And so we were having an issue where people weren't compliant with testing because of the cost of the test strips and the access to be able to do that. And so we made the decision corporately that it was financially viable for us to start paying for these maintenance drugs for people and make them at no cost, right, for them. So we picked a wide variety of your maintenance drugs, whether they're for your cholesterols or blood pressure, for diabetic, for testing and other things like that, and made them available for free. We saw the compliance for diabetes go up, and we saw the claims and hospitalization and other things going down related to them for crisis. And so those are things that really can have a direct impact that were very easy for us to measure that. We have partnered also with other point solutions for other things related to MSK injuries and other things like that is available, but we're a little bit newer into those to understand how they're working as well.
In terms of pitfalls, one thing I would say to avoid is designing with the average, hypothetical average employee in mind. If you remove flexibility and choice, I think that is definitely a pitfall. One of the human truths is humans want choice. So I would say start with listening. I know Kendra talked about listening, so start with listening and then build it with inclusivity in mind.
Yeah. And this one, anyone can raise their hand because we're, I think, down to our last minute or so. What are some trends that you're seeing in the wellness space? We talked a lot about financial wellness. We talked about the use of AI to sort of tailor these programs for employees. Any trends you're seeing other than those? Kendra?
Something I'm interested in is seeing the advancement of pharmacogenomics or how medications interact with your genetic makeup. I think that's going to create a game changer for things even like mental health and failed antidepressants or failed anti-anxiety medications. A simple test can help you understand how your genetic makeup will react to those types of medications.
I'd say the other thing is, really, we have to start being a little bit more progressive about how we're integrating caregiving benefits across the board, right? Not just FMLA and not just, other, paternity, maternity leave. There's just a lot more need for caregiving. I think Larry talked about that. You have children, you have parents, you may have other people that you're responsible for in your life. We are gonna have to be more progressive and mature about how we integrate those total caregiving benefits and not just defaulting to what the law requires us to do. Yeah. So I'm hoping to see some evolution in those spaces as well.
Yeah, I love that. Well, thank you so much to our panelists for giving us all these great examples. And thank you for your time.